want to welcome everybody to this lunch and learn session. I brought my brown bag. Lunch and learn session on encryption. And I want to welcome our panelist, Anne Genge from Healthcare Compliance Inc. in Toronto. No stranger to us here in Oasis. But Anne, you want to talk to us about a very important topic that's hitting the headlines, and you believe that every dental office should be up to speed on it, and it's encryption. What is encryption, and why should I as a dentist be up to speed about it?
Well, encryption really is the gold standard, and in most provinces the legal standard for basically securing your data, whether it's living on your servers, your laptops, your mobile devices, or when being transmitted to another practitioner or even to a patient. So we're going to go through and talk about exactly what encryption is, how it works, and really why we should care in dentistry, and how to and where to get that implemented.
But dental offices, why should we worry about it?
It's funny, I hear that a lot. People say, well, we just work on teeth. Who cares? Who would want to, hack into or steal a dental computer? The thing is, we store really a treasure trove of information in our dental offices. It's really pretty much a perfect storm for getting access to those files, because we have sometimes generations of family files which have mother's maiden names, birth dates. Some offices are still even storing credit cards within those systems. So we have really the perfect identity theft profile within a dental practice. So aside from that, we have compliance laws in each province. And many of the colleges have their own recommendations and guidelines for data protection, which all include encryption as a standard.
So it's important to have the old London Derriere covered,
eh? True.
And you've got a presentation, and I'm going to ask you to start calling that up.
Okay, great. So, we want to keep it pretty tight and really just relevant to what's really important for us in the dental practice. So I'm going to try to touch on the main points. It's certainly not going to be a perfect fit for every single practice. It's always good to involve our IT providers on sort of the each aspect and how it fits your own circumstance. Of course, we want to really take a look at understanding what it is, encryption, again, why we need it, where we need to implement it, and how you do it. So when we look at the definition, if you look it up online, you often get IT talk, which can sometimes be a little bit difficult to understand. Really, all encryption is something which takes readable data, scrambles it up, requires you to input a password, or as they call it often, a key, and then it basically unpacks it or decrypts it and allows the intended recipient to read it. So you can see here, hello became basically gibberish. We applied a password, or as they more commonly term it, a key, and it descrambled it and became readable here. So it's the standard to prevent unauthorized parties from being able to read our information. If someone gained access to a piece of hardware like a server, a laptop, laptops are commonly stolen, mobile devices, and or if an email was intercepted, or as has all happened to us at one time or another, email gets sent to the wrong person. So that's why we're going to be using this in many different aspects of our practice. And here's just some of those statistics. And the reason I put this up here really is there might be some people logged in that are just logged in because they feel, well, it's compliance, or, I have to do it for the practice. I think this presentation should resonate with many people, even on a personal level. And the reason why, when we look at some of this data, this is from Consumer Reports in 2014. 5.2 million smartphones were lost or stolen in the US. 66% don't even have a password on them. And this one's really quite astonishing to me. This was just a study done by ESET Security on just the dry cleaners in England. And last year there was 22,000 USB sticks left behind and 973 mobile devices. And unfortunately, just to make a little story of clarity here, one of my friends was going through an unfortunate divorce and had stored all of her legal documents on a USB stick. Long story short, she put it in her backpack, and one day she gave her backpack to her child, who took it to her husband's house. Husband got all of the information and legal documents and stuff to do with her medical records. That was to do with some of the bad stuff that was going on. That is a real life human story of why we should just even buy USB keys that have this on it, so that, you know, when we lose our own personal information too, we're not, there's a lot of stuff on those things that are sensitive, even some of your photos, if you think about it. So that's why everyone should listen, as well as, you know, why we're here from a compliance perspective. So, but bringing it back into our own, you know, practice environment, when we look at what patient information needs to be encrypted, we see a term come up quite often called PHI. This is personal health information. And this includes any information as it relates to someone's physical or mental health, or their insurance, their diagnostics, or their treatment. And really, the answer to this, what information needs to be encrypted, essentially is basically all of it. And as I said earlier, we have complete health histories. And health data really isn't like a credit card or a bank account number that can be changed. It's a lot of it to do with our, you know, very personal details of our lives that could be, in some cases, things like medications or critical illness. And I think what's really important for us to remember, even if we're not being vigilant about it, again, because of something like compliance, we need to think of the real life scenario of how we would feel if that type of sensitive information got out, because it's not just about threat of theft or fraud, that it can have long-lasting implications to people's relationships, employment, or even their insurability. Because as we know, once a copy of this information is out there, we can't just pull it back. It's not like we can shred one piece of paper and it's gone. So,
and do you think that you know, if the public or patients are aware of this potential, they might actually hold back on divulging sensitive personal information to their healthcare providers?
Yes, and actually there's been, I want to call it London, I can't remember the name of the study, it's unfortunately, but there was in Canada now 2 studies done, I think in the last 10 years twice, where they looked at that. How forthcoming are people with their health information because of this type of scenario? And I think, you know, what's really bad is that it can have some fairly serious implications if we don't divulge things like addictions or drugs that we're taking and so on. So yes, it was a high propensity of withholding, and that's unfortunate, and it's going to take a long time for people to regain confidence in the healthcare system that way.
It just shows there's an onus on us to really show that we have that we're doing everything we can to take this game seriously.
Yes, well, within that study, it actually, and I think I showed this slide in a previous presentation that we did last year, and I believe it was 56% of people that were surveyed said that they would leave their healthcare provider if they knew that there had been a breach there. Mm-hmm. So it is important.
Well, one of our viewers has already come in with a comment, and I'll read it to you, Anne. I know that if we lose a patient chart, we need to go through a ton of hoops to address it, and the patient must be informed. And so, you know, yes, there's a ton of hoops. So we got to be really secure. Yeah.
Yes, and of course, what we're talking about today, encryption, relates to the electronic health record. But I think, there's a slide later on that we'll look at where we see, just, how great the dental industry has embraced the digital environment and how heavily reliant we are on the digital environment. And a dental office even more than most other healthcare practices, because we integrate so many types of imaging and other types of software to bridge together for treatment planning. So we already know, we just discussed that basically we need to be looking at encrypting any health information, whether it's living on our systems, even accessed by our systems, or we're transmitting it to somewhere else. And that includes things like our servers and our workstations, any laptops and mobile devices, portable drives. Backup drives are notorious for this. So a lot of practices find it very expensive to back up all of their images. So I have some clients that have 200, 300 gigs of data. And so the most reliable and budget conscious way for them to do that often is by putting it on a portable drive. But we make sure that we encrypt that drive so that if it's lost in transit, because what I'm talking about here is that many people will take them home, right? Take them off site to protect from fire, theft, and flood, is that they're encrypted and have a password to access that data as well. And these little USB guys, they're so convenient and they're so widely used, but as we just saw, they're so often lost as well. So, and then obviously in transit, and we're going to talk about the differences of that in a second. Do we have another question waiting there, John, or are we good?
Yes, so let me just have a look. Yeah. So how would we know if our portable drive is encrypted or a USB?
So when you plug it in, it's going to have a little thing pop up, usually in the right-hand top screen, that says that it's encrypted, and it would ask for a key, a password. And if it doesn't do that, then it's not. There's two ways to facilitate that. You can either buy them with encryption on them, and Kingston, I don't want to be a commercial for anything, but it's just, this is a
yeah, because I have a couple of drives that are Kingston drives, yeah.
Well, they specifically have one called a data traveler, and they have one that not only has encryption, but it also has antivirus on it. Right. Now, it's not your $8 version. They start at around $70, I think. But right. those are very, I really like them because it protects you from an encryption perspective, but it right. also prevents you from transmitting viruses from one system to another.
Very good.
But anyway, that's just off the...
Worth the cost.
Yes. So I do see some questions still waiting in there. I want to take one more before I move on. Then
this is the person who asked the last question just has answered, like, sort of worth every cent. There's an old saying where I come from: if you pay peanuts, you get monkeys, right? Anyway, off you go.
Okay. So anyway, as we discussed, we have a very high level of practices that have, or high percentage of practices which have embraced the computerized environment to some extent or another. And as we know, there are many that integrate many types of devices and sometimes, and softwares, and sometimes those actually also present areas of concern that we have to look at as far as, being vulnerable. And so we look for things to make sure that if the data is being transmitted from one place to another, that again, there's an encrypted system for that, or that if it has to travel on a key or a hard drive or something, then that's covered that way. And really what they're talking about, you're going to see these terms come up: data at rest and data in motion. And it might seem obvious, but just to properly define it here, data at rest is data that's not actively moving from a device to a device or a network to a network. So that's static things that a server that sits there and stores our information. Ideally, our workstations as well, and I know that we'll probably get some questions pop up about causing disruption of workflow, being cumbersome in logins and system speed. I am the messenger, and I can speak to all of these things as being best practices, and in many cases being a minimum requirement for compliance in most provinces. But anyway, we can't not give the information just because it's inconvenient. But ideally, any static piece of hardware that stores or accesses or transmits information should be encrypted. And then data in motion is data that's going either over email, through a private network, or a portal. And portals and secure encrypted emails are very popular ways now to get information from one practitioner to another in a compliant way.
So, Anne, just basically on your knowledge of the sector, are many dental offices transmitting data in unsafe ways?
We have a long way to go. I think that I think people don't know what they don't know, and I think that's why it's really important that we keep doing these types of webinars and videos and presentations, because I think as we've seen before when we've had any of these discussions, is that dentistry tends to be a little bit siloed, or actually is quite siloed from the rest of healthcare, and really often doesn't get the full scope of what compliance means, and that they are all responsible in the same way as, say, hospitals are and larger organizations who would by default just have these tools in place, but because we're working and operating our data in our own little practice environment, we may not be aware or may not think that we can afford these tools. Mm-hmm. Secure email is $10 a month in most places now. So I think it's accessible, but people just have to be able to think about making the change, embracing the change, and making it happen.
Can I relate to you a couple of comments that have come in from viewers? Yes. Is that okay with you at this stage? One viewer says, the challenge, as I see it, is for data sent between general dentists and specialists, or dentists and insurance companies. And the problem is the lack of standardization. If I deal with 5 specialists, it's entirely possible that I have to deal with 5 different encryption programs to do it. So would you have any comment about that?
It is true, and that's exactly what happens. And I hope that it actually happens more, because that means that there's more people embracing it. I think most of the secure email platforms that I've seen basically send you an invite and say, create your own password. Now, of course, we always recommend that people should use a different password for each different thing. But there are sort of what you would call password creation strategies that allow you to have a very similar password, but maybe 1 or 2 letters different at the end, depending on which practitioner they have. Or, some people just keep the same password regardless, because they feel that if it's, each is a different service, then that password should suffice. It's not a perfect working system yet. I know that I believe the CDA, you have worked on some of these portals in the past. They're not easy to deploy in a really simple way, but I know that there's a number of people invested in making sure that they get something like that going, that makes it much easier to just not have to deal with a number of different providers, like you say. So
generically, the concept of an organization like CDA acting as a standardizer is a good way to go.
If they can nail it, that's the big win. That's a real big win, because then people don't even have to decide whether or not the provider is good or not. It just happens. The problem is, email is just still so darn convenient, and yet it presents all the same kind of risks and vulnerabilities as those silly USB keys. And that's the problem. The more convenient something is, typically the looser it is for.
Well, I want to get you back on track again, but that's a perfect segue to the second comment that's just come in, and the person says emails are a killer, wide open, just implying that it's okay, just because anybody else is doing it. Just because everybody else is doing it because it's easy doesn't make it good for you. Okay? So back on track with you, Anne.
Yeah. Okay, so just under this data in motion thing, we need to be aware also that it can include text messaging or SMS. I don't know of Canadian providers, but there are some apps out of the US that are HIPAA chat type apps that we can use, which are secure encrypted text messaging. So if you're in a scenario where there needs to be some case discussion over SMS, some of those apps do exist. And I don't recall them being too overly expensive either. So again, just to reiterate, the data at rest, any place where patient data is residing, we need to have this encryption completed and the key stored in a safe place. Because if you lose that key, you won't get that data back again. And really, you want to have that sort of safeguarded by the dentist or the privacy officer of the clinic. Please do not rely on your IT providers to be the guardians of your passwords. I have seen numerous cases over the years where the passwords were only known or remembered by the IT providers. Sometimes those relationships break down. Sometimes those people are not available to you to rebuild a server on a weekend. So just as a general rule, not just encryption keys, your administrator passwords, everything, you are required to safeguard those yourself. It's written right into most of the provincial legislation, but just even for your own peace of mind. I've seen even people write them down on pieces of paper and just put them in fireproof boxes if they don't want to take them off site. Be innovative, but be the keeper of your own passwords. Don't have them, don't have it relying on your IT. So all email containing any patient information must be sent through a secure portal or a secure encrypted email. And again, we're going to identify whether or not text messaging should even be used. In some cases, I've seen physicians de-identify. So, for example, I have a client that she does do texting back and forth with her clients. She's a psychiatrist, and sometimes she needs to be accessible. And she just has initials. So Mary Smith would just be MS. Then she makes it practice to delete that text message immediately following. So that's de-identified, and that is a very good attempt, I believe, to allow that to happen, but in a secure way. When we look at how we do encryption, free software is available in some of the more recent operating systems. They have something called BitLocker, which you can turn on. There's certainly software that you can purchase licenses and have your IT put it in place for you. A common way to deal with this now also is to have what they call like as a service or a subscription-based scenario. So that can be deployed on your laptops, servers, workstations, and obviously subscription-based through email as well. And here's one of the challenges, and our company works on this, and we'll be rolling out something to do with this soon. Part of the challenge with encryption is, we can put it on or we can not put it on, but as long as we can prove that it's encrypted, if it's lost, you're in a very different scenario with breach reporting. So if you can prove that it was encrypted, it changes things as far as how you have to report it, or if you even have to report it, and how it rolls out. So this is where we got to get to, is not only deploying this, but being able to prove up to the minute that that encryption actually was on that device, machine, hard drive, whatever.
So does BitLocker fit the bill? Is it good enough?
So BitLocker, I think BitLocker is okay. The thing that we need to be able to get to now, though, is being able to prove, if a system was lost, being able to prove that it was actually installed on that machine. Otherwise, anyone could just say, oh, I had BitLocker on it, no problem. And we've seen a couple of cases now where Now, they're just not taking people's word for it. So
Right.
I think what's great is I think in the next few months, you're really going to see a change and accessibility in an affordable way to be able to deploy encryption in a number of different ways, but also be able to report on it and have a little printout that, yep, yesterday it still was encrypted and we lost it last night, but we're okay. We don't have to create a huge investigation over this.
Right.
So.
Okay.
There probably are a couple of questions waiting there. Do you want me to just?
No, I've indicated that we'll comment on those once you're finished with the PowerPoint. How about we?
Okay, perfect. Okay. So important also, some of the language in some of the provinces now is really being a little bit more clear with regards to who is responsible. And it used to be that we thought that it was only what we would call the health information custodians, aka in our scenario, the dentists. Most of the legislation now reaches, and the regulations now reach as far as all third parties supporting practices. So we're talking about software providers, IT providers, anyone with access to the systems. So for example, software providers and IT providers might take copies of data or may decide that a computer has to go off site to be dealt with. And they're responsible to make sure that the data is dealt with in a proper fashion. Funny enough, it even extends as far as volunteers in our practice. In some provinces, the language even includes non-paid staff. So compliance reaches that far now, guys, okay? I'm going to make this presentation available for a download after. And so there's two things. This is a checklist. So it talks about, do you have a policy for data protection? Are your practice and servers and workstations encrypted? Ask questions that'll help guide you to seeing what the weaknesses are, or what the gaps are in your practice so that you can get them addressed. This one here, do you allow staff or others to connect your practice from outside location? And by what means? And I see this an awful lot. This is a way to connect from outside. This is not a secure, compliant method. So that's a question that needs to be asked in every practice and addressed by the IT. And by the way, if your IT doesn't have good, strong, confident answers about these things, you should check around. It's very important. So I've also included here a checklist for each item or area that could be looked at as to whether or not it's been done, what the method used. So in this circumstance, we would say, yes, the server's encrypted, and we would write here that it's BitLocker. Workstations, laptops, etc. So you can go through and you can fill that out and see where you're at. And it's just like a little worksheet there. And obviously, this is a topic that is very near and dear to me. And I'm sure that the people that have been keen enough to log in here today may have more specific questions. And I welcome people to send me an email, and we'll try to get that answered to you and support you in the best way that we can.
So, and let's address some of the comments, questions that have come in. So I'll open them up and I'll relay them to you as I see them. So I'm going to read them off the screen. So a viewer has said that their dental regulatory body, their college, just for shorthand, requires that the dentist must keep a record of all communications from patients, and when communications are coming in from all sorts of sources. And this will be a serious problem for the dentist to maintain. So what would you comment about that?
I know that is, it's come up a number of times. When I set up a practice, for example, with email is generally the biggest challenge. And what people should be thinking about, not just deploying encryption across, a ton of different email addresses. Get one. Have it set up on your own domain, not a Yahoo or a Gmail or anything like that. It should be, info@, drsmith.com. That's your domain. And only use one channel for communicating patient information in and out. And that's the way that you deal with that, so that you don't have to go and look through and investigate a number of different email addresses. If you have what's called an exchange account, that will keep everything synchronized across devices as well, so you can all access, a number of people can access that one email address, but it keeps track of everything as far as how it's been responded to, etc. You want to have a very large capacity in your email as well, so that you can have archiving, so you can always go back and look. In the US, they have an archiving rule, so that you always have to be able to go back and look at that information. Here, we're a little bit behind, but I see it coming. When it comes to the other ways that you're communicating, hopefully, if you're using patient communication confirmation type software, it's kept only to things which are just your appointments at such and such a time. So I think those types of companies have been doing a little better job at making sure that sort of real PHI doesn't exist within those types of communications. And then most other things are kept right within your practice management system and bridged with your image management system as well. So I think you're okay. I think the big gaping hole generally is still the email. And most other things either get scanned or inputted directly into practice management. So
yeah, so that's very nicely dealt with. Keep things tight in one spot. Another comment or question that's come in, and you talked about to be able to prove that your stuff is encrypted. Can this be part of backup? How is that done?
I don't know of. It could exist, but I don't know of any software that does real-time reporting on that as of yet. I think that you're going to see something emerge in the next few months that, regardless of whether it's sort of on an external hard drive or on an actual system, you can pull a report that way. Because the point is that you can encrypt a hard drive at a certain point, and you can say, I did it on that day, but maybe that was last May. And so how do we prove that it's still there on that drive? And how do we prove that it was actually that drive? And again, I think what you're going to see emerge is a solution to that problem that will list all drives to that practitioner that are attached to those networks and say exactly that it was on that day was encrypted. And that's a monitoring type of product.
Another question, a specific technical question, is LogMine secure?
Okay, that would be log me in. And I
thought it was showing my German there, right?
No, that's okay. It really has been kind of what we would consider a gold standard for a long time. And it's really widely used. I wouldn't have liked it to become so expensive as it is now, and like a lot of things, they get you hooked, and then the price goes up and the price goes up. Yeah, that's still a very popular way, and the last time I checked, anyway, was still a very secure way to provide remote access without being worried too much. So
right. So should your IT people sign PIPEDA or FIPA or anything like that? Is there anything to be gained by that?
Well, actually, again, in most provinces, that's a legal requirement that you have a business associates agreement with them. IT providers supporting healthcare have to abide by all of that legislation and regulation in the exact same way as the healthcare provider. They are as responsible as the healthcare provider. So everybody really should be seeking an IT provider that is, for example, in Ontario, PHIPA compliant, or whichever province they reside. Those companies should be able to prove that. And that includes things like going through security assessments the same as dental office have to, monitoring for security the same way as a dental office has to. And really, the list is the exact same for them. And they are, as we don't have a lot of data in Canada, but they are a big gaping issue in the US. There's a high percentage of third parties that are really the cause and responsible party for a lot of breaches. So that's something you definitely want to look at for sure.
Yeah. And we're using a video conferencing platform for this, Zoom. And when I look in the top corner of my screen, I see a green like padlock. And yesterday I was speaking to somebody on here and he immediately latched onto that and said, oh yes, well our conversation is encrypted. Well, what does that green padlock mean? And
I'm smiling because for years I was so, I didn't like Skype, but I kind of had to use it, you know. And I'm smiling because it was you that introduced me to this platform and I use it everywhere now. And what's great about this little green E that we see here is saying that it is using end-to-end encrypted connection. And that satisfies, this could be a communication tool between practitioners to have patient discussions, collaborating.
Yeah. Well, we're using it here for essentially virtual study club, so it's the equivalent of that. But you know, that's I just wanted to know about because I was really interested that the guy picked up on it and commented on it. I have another question about encryption and these types of new apps, and that I've heard recently someone put forward that the fact that WhatsApp, which is really, really popular in Europe and it's owned by Facebook, provides for encrypted transfer of information. What do you think of that concept of something like WhatsApp or whatever else app being encrypted and just relying on that for communication between offices?
Well, you know, I wouldn't. I really like and we have lots of choices for healthcare focused or healthcare designed tools for that. So I don't know why we would necessarily have to go there. And I think in light of what we saw yesterday with a company like Yahoo having 500 million emails breached, you know, I don't know that I'm really going to go after using something like that when I have plenty of choices designed specifically for the healthcare environment.
So certainly I think a message that's come out loud and clear through here is to have something that's specifically designed for the oral healthcare sector in Canada and that has standardization. That's the way to go. Absolutely.
And you have really a good amount of choices on that. And we're not going to we're not a commercial here. But again, you know, if people want to reach out and ask me those questions, I'm glad to help shoot them in the right direction. So.
Well, Anne, you've been very generous with your time. We've gone for the guts of 40 minutes. We've had a very interesting presentation. I'm just delighted with the engagement of our viewers. And
very impressive.
We don't hear any more questions or comments come in. Oh, well, there is something else. Well, we'll see what that says. Let me just see that. Somebody just commenting and that they really love the checklist. So that's amazing that you're providing that. And that's one of our goals here with Oasis, is to provide tools that are of practical everyday use. And of course, it's just amazing that we can work with the likes of yourself and to share knowledge. Likewise,
John. Thank you. And those were really great questions today. It gives me a lot of hope for the journey that we're on in trying to do a better job of not just protecting patient data, but really it's about protecting our practices. And dentistry being so reputation based, it's just a great business decision, and it becomes a competitive advantage as well in a lot of cases. So I'm very happy and optimistic about and I can see all of the participants here. It's just delightful. So thank you, everyone.
Well, Anne Genge, thank you ever so much for this very informative session, and thank all the viewers for engaging so fully. We'll have a recording of this incorporated in an Oasis post in double quick time. And all I say to participants is spread the word, and look forward to seeing you back for other very practical, useful sessions like this.